going to go ahead and discuss family planning from chapter 3 as well as chapter 1 and ATI. Um, so, what is family planning? It allows individuals to decide when and if they want to have children. Before starting some contraceptives, they may have to see their PCP to perform a physical exam, whether that be a pap smear, get blood testing done, an STI screening, just to ensure safety. Some types of methods that are there are natural infertility awareness methods, barrier methods such as condoms and diaphragms, as well as hormonal methods such as pills, injections, and patches, IUDs, surgical sterilization, and each method has its advantages and disadvantages. And I did include examples as well as their definition and advantages and disadvantages of each type of contraceptive. We have the natural family planning. These methods are used by women because they are low cost, hormone free, and more acceptable when it comes to religious and cultural beliefs. I have a few listed here as well as their advantages and disadvantages. We also have more additional, which are like your standard day methods, your calendar rhythm methods, your body basal temperature monitoring, and your cervical mucus monitoring. So that is something to consider. I think the biggest thing that stands out is that overall, they don't protect against STIs. So that's something to consider. And they do have advantages as well as disadvantages. So when we talk about barrier methods, these are contraceptives that prevent the sperm from entering the uterus and traveling to the egg. These are available over the counter, or some of them may be required prescription. But the one that we're familiar with is your male condom, but they also have your female condom. And again, just like I said, it doesn't protect against sexually transmitted diseases. And the biggest disadvantage about a male condom or even a female condom is that you have that potential risk for it to tear. Additional barrier methods, you have your spermicide, you have your sponge, you have your cervical cap, as well as its advantage and disadvantages. So to sum it up, the advantages is that most of them are over the counter. Most of them don't require a prescription. They're inexpensive. The only thing that really stands out here is your safety stat. Just know that if you do go the diaphragm or cervical cap route, your cervix is not going to return to pre-pregnancy size. So you may want to consider a more reliable contraceptive, and that's just something to consider. Or maybe see the healthcare provider to make sure you get the actual fitted size. Your hormonal contraceptives, they contain your progesterone or a combination of estrogen and progesterone to prevent ovulation, as well as some advantages and disadvantages. The biggest disadvantage in the contraintroduction, which this particular contraceptive, is that you have those potential risks for abdominal pain, chest pain, headaches, eye problems, severe leg pain. And we want to remember these risks by the word aches. We have combined oral contraceptives. We have what you call the pill, as well as its advantages and disadvantages. And we have the mini pill, which is your progesterone only. Again, it has its advantages and disadvantages. I think one thing that stood out is that it's considered safe to take while breastfeeding. So, you don't have to think about that. Again, the only thing is that it doesn't protect against STIs. Another type of contraceptive is your transdermal patch. And this is just something that's to be worn. You can wear it in your lower abdomen. You can do it on your butt cheeks, your upper body, but do not put it on your breast. And they release estrogen and progesterone into the bloodstream, and then you have to apply a patch every 3 weeks. The biggest downfall on this is that it can cause irritation on the skin, and it may come off. You may not even notice. So then you have that chance of you may come out pregnant. You may be pregnant. As well as the vaginal patch or vaginal ring. The thing with this one is that you have that possibility of it slipping out during intercourse. So, or it can even cause vaginal irritation. So that's something to take into consideration if you choose to do this route. As well as your depot shot. The thing with this one is that you will have to make appointments to see the go to the doctor and get it done, or even a nurse visit. And the only thing is that it's your biggest priority is to make sure that you make that appointment and you keep that appointment. That's just the biggest thing there, and as well as any risks that come with it. You have your implantation progesterone as well. You have to make an appointment to get this done, and it's effective for 3 years, and it doesn't require daily medication. So that may be something that you can consider if you're not compliant with your medications, as well as your IUDs. Your IUDs is something that gets implanted as well in the doctor's office. The big plus about this is that it provides 3 to 10 years, depending on the type that's inserted. Again, the only thing is that it could be potential for um, some. You could have some possible pelvic infection. You could experience heavy and painful periods or no periods at all. So that's just something to keep in mind. And then, as well as your emergency contraceptives, there are a few here listed, and with disadvantages and disadvantages on that as well. Now, if we want to talk about more of a permanent contraceptive, you have what you call your tubal ligation, and then I'm going to talk about a vasectomy here shortly. But your tubal ligation is something that's done. It can be done as an outpatient. Advantages is that it's sterilized, no hormone therapy is required. It's reliable and it's permanent, so that's something to consider. Surgical procedure for some women. The only thing is that they may regret it. I mean, they may decide later they shouldn't have done it. So that's something really to consider, as well as your vasectomy. This is something that can be done on a male or your partner. And some advantages is it can be done as an outpatient setting and doctor's offices at that. The only biggest thing about this is that some males may regret the decision, but then again, that's something to consider as well. Now, when it comes to nursing care related to family planning, we just want to be able to provide our patients the best education so they can know exactly what is it that they want or that's appropriate for them. Make sure they're aware of the side effects and that they're educated on what fits them best. Now, when it comes to the nursing process, something to consider when you're doing assessment is you want to set those goals for your patients. You want to respect the fact that their culture and their religious beliefs. You want them to be aware of side effects. You want to be looking for those vital signs. You want to be, especially your blood pressure. You want to be making sure that they have their labs, make sure they're not pregnant, making sure that they've been screened for STIs, and you want to look for those adverse reactions, the abdominal pain, the headaches. And then, in regards to nursing diagnosis, your deficit knowledge related to contraceptive use, your risk for ineffective health maintenance related to inconsistency of the contraceptive use, risk for injury related to potential complications of hormonal contraceptives, safety concerns, blood clots, hypertension, infection risk from IUDs, or incorrect condom use. So, what are we going to do about it? Plan. We want to be able to our patient verbalize what they have chosen, what kind of method they're choosing. Are they doing it correctly? Do they know their side effects? We want them to be able to feel comfortable with what they're using and be safe at it. As far as interventions and rationales, we want to assess their understanding. We want them to be sure that they are making the correct decision. We want them to make sure they're using it properly so they don't have unintended pregnancies. We want to encourage them STI screenings to prevent infections. We want them to be aware of those early life threatening complications. And how do we know this is all going to work? We're going to make sure that our patient understands that they monitor their side effects, that their adherence with what they're using, that they're safe at it, that they're aware of those side effects, that they're not having any of those side effects. I did include some NCLEX questions. I did include 2 questions. So this is a question that you can kind of read over it and go through the answer choice, see what you decide. I did include the answers as well and the rationales, as well as question 2. I did include that as well as the answer choices, included the answer choice and the rationale. And again, the sources that I did use chapter 3 from our Matt Neal book, as well as our ATI chapter 1. And I do appreciate your time and thank you and happy studying.